I wasn't having back pains, I wasn't hurt or any auto accidents. I went there for total health.
I've had pain for probably 30, 40 years.
My legs were uneven.
Motorcycle collision.
Had a pretty bad spill. Car accident and hospital 45 days.
I've struggled with very, very painful periods.
Pills didn't work anymore.
I tried muscle relaxers and physical therapy, but they weren't working.
I've never really gotten any satisfaction from my doctor.
My wife said, I think you should go see a chiropractor.
Hello. If you're new to chiropractic, welcome. If you've enjoyed chiropractic care in the past, welcome back. If you're like most people, you have some questions about what you can expect on your visit today.
When you first begin, it's kind of scary.
The first visit was actually great.
I felt so cared for.
The atmosphere of the office is very light.
You get to know everybody in the office.
It was very welcoming.
I felt really comfortable with them.
Initially, we sat and talked.
She cued in on who I am as a person.
Described everything very carefully and before they did anything.
Thorough explanations of what they're doing, why they're doing it.
I could tell that he cared.
He's a really cool guy.
After I'd filled out some paperwork, I met the doctor and we discussed my problems.
She explained what she was finding during the examination and I felt involved.
The purpose of your examination is to find the exact cause and location of your problem. Sometimes it's helpful to have pictures of your spine to confirm other examination findings.
I did need x-rays because of the car accident I was in, but the children didn't have any need for that.
I can't even remember ever having an x-ray.
I kind of like the idea of x-rays.
It gave him a better idea of where my problem areas lay.
Whether you need x-rays or some other form of imaging, rest assured that only the essential views will be taken, and you'll see them later at your report of findings. Then, with your examination completed, one of two things will happen. In some situations, your chiropractic care can begin immediately. Or, if the examination findings require further study, your chiropractic care won't begin until your next visit. It just depends on your unique situation and the judgment of your chiropractor. The primary form of care in this office is called a chiropractic adjustment.
There are an awful lot of adjustments and types of adjustments in a chiropractic office.
It can be surprising.
Kind of stretches you out a little bit.
You can feel it. There's kind of a pressure.
They'll push down gently.
It's just a subtle little movement.
It felt really good. I felt like a marshmallow or something.
I find it very relaxing, very nice.
Some are a little more aggressive, some use hands, some use mechanical instruments.
It's like a little clicker thing.
It's a feeling of release.
There are lots of different ways to adjust your spine, and your chiropractor has become an expert in one or more techniques so that you can get the best results in the shortest amount of time. Now, some people enjoy quick results, and for others, improvement can take several weeks or more. Since your body is doing the healing, not the chiropractor, results will naturally vary from person to person.
Progress was a little slow at first.
It's an instant relief.
It took us 6 months to get me back walking.
Instant repair.
I think it took probably about 2 or 3 weeks before I sensed a major shift in the pain level.
And how long will you need chiropractic care? It depends on your goals. Some people just want temporary relief. Others want to retrain and strengthen their spine so that they can avoid a relapse. And a growing number of people adopt a schedule of periodic wellness visits so that they can be their very best.
Once you know what your body is saying to you, you know when it's time to go to the chiropractor.
I keep going for the maintenance part.
If I maintain a schedule now, I'm pretty much pain-free all the time.
I know that there's other benefits than just no pain. I wouldn't say I have to go for the rest of my life. I want to.
And finally, how much will your chiropractic cost? Again, that's up to you based on how far you want to take your care.
Chiropractors that we've worked with have been very flexible in terms of working with our finances.
With a family plan, it's a lot. You know, it's economical.
It has become so worth it to me.
I would gladly pay any amounts to keep myself in this good of health.
At some point, I had to ask myself, what's my health worth?